All right, here with medical updates for us, Dr. Tom Hopkins in Roseville. Welcome back, Dr. Tom. Let's get to a question for you. Last week, as you know, the governor relaxed the stay-at-home guidelines for some businesses. We're now into phase 2. Are you comfortable medically with the speed that this is happening?
Well, Walt, I think that the public probably has grown a little bit weary with this and wants it to be a more rapid pace. Again, it highlights the importance of doing phases. The thing about it, the more important is making sure it's safe to return to those environments. But my message to my patients and to the community in general is, we still have to adhere to the guidelines of when you're going into these businesses that you're wearing face masks, and that the businesses are also protecting their workers by having their workers wear face masks. And also, if you're sick, stay home. Don't go out in the public. So we still have to adhere to the social distancing, the good hygiene and sanitizing we're doing to make sure that this phase is done properly so we can move to the next phase.
All right, next question for you, Dr. Tom, and we've talked about this too. You could have coronavirus and not know it. A viewer says, I've never felt symptoms, but should I still get tested just to make sure? Is that necessary? Is it even possible if you're feeling fine, but just for peace of mind?
Well, of course, it's never good to do a test for peace of mind. You never order a test, and a physician doesn't order a test, and you shouldn't request a test unless you're prepared to understand the importance of what you're going to do with that information. So we know that the COVID symptoms could be asymptomatic to having the classic fever, cough, shortness of breath, or loss of taste or smell. But if you don't have those symptoms, there's no reason to actually get tested. So the tests are talking about the blood test, the serology test, to find out if you have immunity. Well, we know that we don't have a good understanding of how that's going to be used. So it's something that no one should use at this point because you don't have a good rationale for what you're going to do with the information.
All right. Based on questions like the one we just asked you and others that we're also getting, it seems likely people want to know if they have antibodies before they go back to work. Maybe they want to know before they visit a newly opened business. Is it helpful to be tested for antibodies, or is the jury still out on that?
Well, I would say the jury's still out on that, and it doesn't change what you need to do. Really, if you tested positive on that antibody screening test, it says you've been exposed. You don't know when you've been exposed, and the fact that you have been exposed, you don't know what kind of protections that's going to offer you now into the future. It doesn't say that you won't be getting or have the opportunity to get COVID-19 if you were to be exposed. So it doesn't have a lot of useful information right now. So it's not something someone should just go out and do just for curiosity. But if you have symptoms, of course, first thing, you stay at home and contact your physician and make sure you get the appropriate test to find out if you do have COVID-19 at that time, so you can isolate, and then we can start with contact tracing to find out who are the other people that may be at risk.
All right, next one is herd immunity. We've talked about building herd immunity. Is there any way someone can build that? Can you explain what herd immunity is, and do you believe in it?
Well, of course, we've known historically that there has been a clinical value of having herd immunity. Herd immunity is when you have a larger population of folks who have had the disease, who now have developed antibodies or an immunity to that. It probably in some degree is going on presently because we have a condition where COVID-19 occurs in asymptomatic people. So the serology test is one that's testing to say if there's antibodies. So if we all had antibodies, what we know that when we had some level of exposure at some time, then that creates this herd immunity. So the thought is if you have this herd immunity, that everybody has antibodies floating around the system, and the more people get that, the more protected they are. But that's true, but we're not there yet. It's going to take time. Herd immunity doesn't develop right away. It's not something that's quick. It's going to be over time, and especially when we have the proper vaccines, when we have the proper treatments all in order as the disease is contained.
Next one out there, I guess, is under preventive, not necessarily medicine, but maybe maintenance. What is your feeling about certain vitamin regimens or certain oils? There's a lot out there right now on the internet that people really swear by.
Well, a lot of folks have sworn by home remedies we've talked about before, herbs, vitamins, and all of these other things. Some of these things are also done in conjunction with things we should do anyway: good hydration, rest, low stress, being healthy, exercise, which we know are help you with your immune system. But there's a lot of things out there that people are doing that say they swear by it's protected them from colds and flus. And I would say the folks where they found that to be useful, yeah, they continue to do useful. As long as what you're doing is not causing you any personal harm, physical harm, mental harm, or no economic harm, then that's okay. But if it's harmful and it adds to your stress and worry, it's something you shouldn't embark on.
Yes, here's one. The guy who works on my car says, take as much garlic and or ginger as your stomach can handle. How does that sound to you?
Well, that sounds like you're going to get an upset stomach.
Okay.
It sounds to me you're going to feel real bad. That's about it. But in terms of COVID-19, what we know, there are only a certain amount of things that we know that have been helpful to help treat patients with COVID-19. And those are done in the hospital where people are fighting for their lives. So all of these treatment recommendations that the FDA is trying to push and evaluate in clinical trials, those are what's going on now. And there's not a medication on the outpatient side that you can do. So the best you can do right now for yourself is social distancing, good hygiene, sanitizing areas, decreasing your spread of disease by wearing masks for both people, and then having a healthy diet with good exercise, good hydration, and those things that we know are probably going to be effective.
The basics that pretty much apply to most anything. All right, Dr. Tom Hopkins, thank you, Tom. Good visiting with you from Roseville today.
This interview involves commercial content. The products and services featured appear as paid advertising.